Amazing how that red reflex looks so good even though pupil's relatively small. So mature cataract, excellent view, clear as a bell. So Joan, it's amazing with this new scope how much detail I can see to do your cataract surgery. See a nice fluid wave despite a smaller pupil. The range of focus is amazing. Mark, one thing I really like is we can focus on the iris and then we don't have to touch the focus ever again, essentially. I can see my instruments above the cornea all the way back into the vitreous. Another thing that's highlighted in this case is I don't have a really large working area because of the pupil, but the pupil is not completely filled up with 2 or 3 lights or just one coaxial light, providing a wonderful red reflex independent of the orientation of the eye. And I found that patients find the light very comfortable as well. Many scopes, Mark, would struggle with the red reflex here, but this is just amazing. With the coaxial light, the single light, it gives that amazing red reflex. It highlights all the detail in the anterior chamber. The outer lining is now beautifully polished. The detail from this new scope is just amazing. You can see just how clear it is. I don't know if you could appreciate it, but having that range of focus from cornea to the posterior capsule made aligning that IOL very easy. Given the detail, I can easily see the corneal hatch marks or toric marks despite the light colored iris. You can see beautifully detailed the toric marks in the lens. See how they line up perfectly. So as you know, it's quite a challenging case. A patient very, very anxious. We sedated to our maximum amount of a few milligrams of Versed and even fentanyl, and still wide awake and anxious. A very small pupil, about 5 millimeters. Could just see the edge of the capsular rhexis, sometimes using an instrument to actually manipulate the iris in order to see it. The depth of focus with the coaxial light, single coaxial light, just allowed tremendous detail, allowed us to basically perform the case without using a Malyugin and actually do so quite easily. With the detail we're able to see, able to do the phacoemulsification with a great deal of confidence, able to do the INA of the cortex very easily, and then just aligning the lens. That can be a very challenging scenario when that 6 millimeter optic is hidden behind a 4.5 to 5 millimeter iris, or pupil I should say, and to be able to manipulate the eye with that great depth of focus and clarity and see those corneal LRIs, not LRIs, but toric marks, and then line that up with the toric marks of the posterior aspect of that lens is just amazing. So very, very pleased with that.